Okay, hello, my name is Patricia Reyes. I will be performing an oral mechanism examination, which is also known as an OME. This examination is used to evaluate the structure and movements involved in speech and swallowing. I'm gonna be asking you, assessing your face, your lips, jaw and tongue, palate, breathing, and your speech production. Okay, now that I have my gloves on, we're gonna go ahead and observe your face. And I'm looking for facial symmetry, your muscle tone, and any abnormal movements or drooping. So it seems like everything's pretty symmetrical. Your eyes, your nose, ears. So it seems like there's no abnormal movements. Okay, next we're gonna do your lips. And I want you to pucker your lips like you're giving a kiss. Okay, seem pretty normal. The size is pretty normal as well. Okay, so now go ahead and smile really big. Perfect. And next, I want you to puff your lips. And I'm gonna put a mirror right underneath your nose to make sure you're breathing correctly. Perfect, and I can see you're breathing. Very good. So they maintained a very good seal. Okie dokie, now we're doing your jaw and your teeth. I'm gonna go ahead and tell you to open, wide, and close. Go ahead and open and close. I can hear a little bit of popping, can you? Okay, perfect. So now you're gonna move your jaw from side to side. I can hear that popping. I do notice that you do have braces. Can you show the camera? And do you feel like the popping is due to your braces, or does it always pop?
I think it always pops. I'm not sure.
Okay, go ahead and try one more time. Perfect. Okay, go ahead and open and bite down together. I do notice that you're wearing your braces, so it's kind of hard to bite all the way down, correct? Go ahead. Okay. Perfect. Okay. But your teeth appear to be very clean, and you have good oral hygiene. Okie dokie, now we're gonna go ahead and observe your tongue. So go ahead and stick it out. I'm just looking that it's symmetrical to your face. Perfect. Go ahead and stick it out. Now you're gonna move it from left to right. Okay. Now you're gonna try and lift your nose all the way to your tongue to your nose. Perfect. Very symmetrical. Okay. And now you're gonna push your tongue to your left cheek. And now to your right. Now left and right. Perfect. Now I'm going to gently press against your tongue with the tongue depressor, okay? And you're gonna go ahead and push it as hard as you can to make sure that your tongue is nice and strong. Perfect. You have a very strong tongue. Okay, now I'm gonna check that your tonsils seem pretty normal. And then we're gonna go with your soft and hard palate next. Okay, so I want you to open your mouth and say "all" while I observe your palate, okay? And I'm gonna use this flashlight so I can make sure that everything looks pretty good in there. So can you say "ah"? Perfect. And I can see those little ridges, how there should be up at the top palate. looking for your soft palate, that it's elevated with your uvula plane. Perfect. So they both appear to be pretty normal. Thank you. Okay, now I'm gonna observe your breathing to determine whether it is adequate for speech production. So go ahead and breathe in and out, okay? Okay, now I'm gonna listen to your voice renaissance, and I'm gonna go ahead and ask you to say, today is a beautiful day.
Today is a beautiful day.
Okay, perfect. I feel like that sounds pretty normal. There's no signs of hypernastality. So now I'm gonna go ahead and ask you a few questions about your oral habits. Do you suck your finger or your thumb?
No.
Okay. What about, do you suck on your tongue?
No.
Okay, perfect. What about grinding teeth?
Yeah.
Okay. Is it mainly at night, or do you find yourself doing it during the day?
At night.
So your speech conversation is pretty good. Okay. And let me make sure. Go ahead and tell me your full name.
Giselle Blanca.
Okay. So it's pretty clear and intelligible. Now we will complete a few rapid speech tests, also known as a DDK. So I'm gonna ask you to say these words as fast as you can, and I'm gonna go ahead and write it down. So our first, okay, so now moving on to our DDK task, I'm gonna ask you to breathe in and out and say pa, pa, pa as fast as you can. And I'm gonna go ahead and write the number of repetitions and the number of seconds you were able to do that. Okay, you ready? Begin.
Pa, 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 pa.
Okay, our next word will be ta, 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 ta.
Ta, 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 ta.
Perfect. And our next one's gonna be ka, ka, ka. So if you need to breathe in and out, you can.
Ka, 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 ka.
Okay. Now you're gonna go ahead and do pa, ta together as fast as you can.
Pa, ta, pa, ta, pa, ta, pa, ta.
Okay, and now we're gonna put all three together, so it'd be pa, ta, ka as fast as you can.
Pa, ta, ka, pa, ta, ka, pa, ta, ka, pa, ta, ka.
Okay, so that was great. Now, this is the conclusion of our oral mechanism examination. So based on today's observation and oral structural movements, it appears that you're within normal limits, except that droopy eye. So I'll go ahead and write that up, and I don't think that will affect your oral motor function and speech production. But I appreciate your participation for today. Thank you.